average adult gets 3 colds per year, and each lasting an average of 9 days. But you don't have to surrender. Oh, no. Bradenton Cardiology Center and Daytime's resident doctor, Srinivas Iyengar, has tips on how to stop a cold before it takes hold. Dr. Iyengar, good to have you back.
Great to be back.
I thought when you had a cold, you just had to live with it.
No, unfortunately, most people do get colds during their lifetimes. And, the fact is, when you do sense getting a cold, there's a couple of things you should probably be thinking about.
Okay.
Well, first and foremost, once you get a cold, think about who you're exposed to and who you're around. If you feel like you're getting a cold, a cough, sniffles, sore throat, any of the above, try to stay away from other coworkers, because in the first 3 days, you're pretty contagious. So it's really important to make sure that you're not infecting anybody else around you with the cold.
Right.
Now, the thing is, though, we don't always have that choice. Some people have to go to work, you got to go. And the thing is, what can you do to treat it? So vitamin C, zinc, these are over-the-counter supplements that can help, actually. And if you do have a fever, taking Tylenol is also something that can help as well.
We've all heard chicken soup, and some people swear by it. And I've also read that there are some studies that show that it actually has a compound in it that works.
Yeah, and the thing is, it does. The fact is, millions of mothers can't be wrong. Chicken soup and a lot of foods with antioxidants, especially, can definitely help. So the main thing is eating healthy, but taking a lot of fluids and getting a lot of common sense really trumps a lot of the medical practicing that we do a lot of times.
I've heard some people say if they drink really strong liquor, that helps. Is that?
No, I would avoid the liquor predominantly.
Okay, all right. And some people think they can sweat it out, so they go and work out really hard. They think, I'm going to get this virus out of my body. Can that happen?
No, and the thing is, naturally your virus will pass and shed through the liquids in your body. Okay. But the thing is, sweating it out will actually potentially lower your immune system further, because you're really stressing your system more than it should be at the time.
Now, I know some people will run to their doctor right away as soon as they get a sniffle and go, give me antibiotics.
Exactly, and that's a huge issue too, because a lot of people at home are watching a Z-Pak. It's a very common antibiotic 5-day course of antibiotics, and the thing is, it's not the answer here. These colds are viruses, they're not bacteria, so the antibiotics don't do anything for these types of situations. Time, rest, fluids. Naturally, if you have a cold, can it develop into something? Yes, but there's usually a time period. We like to tell people, wait about 7 days, 9 days. If it has progressed, if you have a worsening fever, myalgias, which is muscle pains, if you're developing greenish, discolored sputum from initially a clear sputum, those may be signs you're developing something else. But otherwise, stay away from antibiotics for these colds.
There are myths out there, and there are some people who still believe if you go out with wet hair and it's cold, you're going to catch a cold.
No, and that's not the issue. It's more or less that what you're exposed to in the environment, not necessarily that you have a cold hair, but your immune system to begin with. And the cold is easily transmissible. These types of viruses are easily transmitted to different areas. So wash your hands. That's the biggest lesson I can give today. Why
does it seem to hit more in the wintertime? That's why I think people make the correlation between the weather and having a cold.
Well, I think a lot of times people are doing much more during this time. And also the holiday season, stress is huge. And there's a lot more people cross-pollinating, shall we say, across the country. People are traveling back and forth to see each other, so there's a lot more issues going on than just the weather itself.
Can we really help ourselves by carrying wipes around, wiping down everything?
Well, there is a level where people may say it's too retentive, but I do feel, to be quite honest, that a lot of people aren't washing their hands enough. So I think that's a good start, and I think that there's no reason why you shouldn't be washing your hands, especially after the bathroom, because there's a lot of people out there who probably aren't doing as much as they should be.
And if you notice somebody has a cold and they try to shake your hand,
I would say,
just do this.
Exactly.
Good to see you.
Or maybe offer an elbow.
Right.
That might be the start.
All right, Dr. Iyengar, thank you very much.